Within the field of facial surgery, nose surgery, rhinoplasty or nose jobs are the #1 procedure. They can be carried out for aesthetic or functional reasons and sometimes both. The surgery is delicate as the nose has a vital function to bring in purified air and oxygen to the lower airways, but aesthetics are also important because the nose is situated in the middle of the face. In light of the rise of social media promoting aesthetic procedures with often overcorrected noses, ethical considerations when considering surgery have never been more important. This is EUFOREA News, broadcasting from London. Hello and welcome to EUFOREA News. I'm Dr. David Bull. Rhinoplasty, often referred to as a nose job, is a surgical procedure to reshape or reconstruct the nose. It can be performed for both cosmetic and functional reasons, such as correcting a congenital abnormality or birth defect, improving the patient's overall appearance, opening blocked nasal passages caused by issues such as a deviated septum, repairing a facial fracture like a broken nose, and restoring breathing function after disease, cancer treatments, traumatic injuries, or burns. The procedure can alter the size, the shape, and overall appearance of the nose, potentially improving symmetry and facial harmony. But given the exponential rise in social media recommending nasal procedures with active marketing by particular surgeons or clinics, it's more important than ever that surgeons respect ethical standards before scalpel touches skin. Well, to tell us more is Professor Enrico Robotti. He's past president of the Italian Society of Plastic Surgery. He's also past president of the Rhinoplasty Society of Europe and former chief of plastic surgery at Ospedale Papa Giovanni the 23rd in Bergamo in Italy. Professor, thank you so much for joining me. Perhaps we could start by asking, what do you think patients deserve to know or realise when they consider undergoing a rhinoplasty?
Well, it's difficult to reply in a short time, but let me think. I mean, they essentially have to understand the difference between what they would like as expectations, their own expectations, and the technically possible outcome. It's a little bit different. Not all the time this can be achieved, and this difference has to be honestly stated. That's #1. Then they have to have some notion of the techniques to be used and of the complexity of such techniques. This is also important. And then I think, rather importantly, function should be noted. I mean, sometimes they just are after aesthetics, and the function is something that should be probably more relevant than anything else. So function and shape come at the same time. So it's hard to say what they should know, but this is more or less what is important for them to know.
And of course, you make this very clear when you talk to patients in pre-op about, as you say, expectations, the techniques and function. Just in terms of when you do talk to those patients, what do you believe is the biggest challenge when you do talk to those patients in terms of how much they know, what their expectations are? How do you try to counter some of those challenges?
Well, I listen to them very carefully because I do only noses. I have a rather vast experience and I teach this. But what I really want mainly to spend my 1 hour consultation time, and then there's another half hour after the morphing. But in that hour, I don't want a show off of my cases. I want essentially to understand who I have in front of me. And if that person has a good reason to be operated and will have a good opportunity of having a good result. So it's mainly trying to understand whether the patient is a good candidate for having a significant improvement from a surgery, which is not as easy, as fast as most patients believe. So again, it's a matter of understanding expectations and having the patient with enough notions of what will happen before the surgery, during the surgery, and after the surgery. In briefly said, I often see people, not so much in my practice, but it's a generic thing, that come to surgery as if they went to a dinner. I mean, this is far different from the truth.
So obviously there are huge ethical considerations here in the field of rhinoplasty. Increasingly so, I would suggest, because we've got clinicians doing direct marketing to patients. We've also got surgeries, we've got surgical centres also directly marketing to consumers. Why do you think we need to be very mindful about the ethical complications and the ethical dilemmas when it comes to those people who are considering a rhinoplasty?
I think it's one of the. I was in Istanbul recently last weekend for a big course, and I could actually touch with my own eyes, honestly, the way that some colleagues, luckily not all, were making talks as if they were actors on a stage. So this means essentially they have a huge familiarity with Instagram, TikTok, and all these things. I do have my own Instagram, but maybe I'm old-fashioned, but I still think that ethics is having a difficult time. Maybe because of obviously marketing and the huge importance of, for some people, of making a considerable amount of money out of patients, we are losing track of a simple thing: be honest with your patients. And let me make another example. It's so easy to play with photos. Not only with Photoshop, you can play with different lighting. The same photo done with a different lighting shows a different nose. The same photo done with the zooming before, with a nose before, makes it seem big and wide and massive. Then the same nose done with the camera further down, further away from the face, and cropped, will show a different nose. There are so many of these tricks which are evident also in meetings. So it's hard to say. I'm not very optimistic. I mean, I believe that ethics cannot be lightly played with, as I'm seeing so often. So what's the advice here? It's hard to say. The advice should go to two directions. One, to surgeons, and I honestly believe we are physicians, and we should be physicians, and we should be honest to our patients. But also for patients, if they go to some surgeon only because of a nice TikTok show with people who are so happy after the surgery with makeup and going to a dinner almost immediately and this kind of thing, this kind of patient needs to be a little bit more educated. So it's a difficult world.
It certainly is. And of course, it's absolutely crucial the patient has informed consent. Finally, if I may just ask you this, why do you consider the European Rhinoplasty course by EUFOREA important?
Well, exactly for the reason I stated. It's not patients-oriented, but it's peers-oriented. And the lovely thing about this course, I mean, without any compliments, it's a wonderful atmosphere. It's honest exchange of ideas. It's good teaching for colleagues. And recently in Brussels, I mean, this really struck me. The atmosphere was a very pleasant one, and all that should be said was said regarding even technical considerations and results. So no play there, just facts.
It's such a pleasure to talk to you. Thank you very much indeed, Professor Enrico Ribotti.
Thank you so much.
Well, joining me now is Professor Alwyn de Souza. He is Professor of Aesthetic Facial Surgery in London. He's also editor of the Facial Plastic Surgery Journal. He's also past president of the European Academy of Facial Plastic Surgery and past president of Facial Plastic Surgery UK. Thank you so much for joining me, Professor. Can I start by asking you, does every deviated septum need correction?
Thank you for having me on. Directly to answer your question, if the deviated septum does trouble you in terms of the airway, breathing, or in any other way, yes, it does need correction. And also, if you're altering the shape of the nose for whatever reason, I think any deviated septum should be corrected and treated to get the best airway possible. It's a quality of life operation. So the answer is yes.
Now, just talking about sort of fads and trends, one of the things that seems to come up a great deal is this Barbie nose. This is when patients are looking to have a small nose. Clearly, there are lots of ethical considerations around that. If you are met with a patient who wants to undergo a procedure to have a Barbie nose, what sort of things would you discuss with the patient to ensure that they do have informed consent?
Yes, I think this is probably one of the most important thing in doing nasal surgery. So if somebody comes to me with a Barbie, with asking for a Barbie nose, I think the first thing I want to know is that how have you decided, or why have you decided you want a Barbie nose? Because that is an important thing. And depending on that, you really need the patients really need to understand what it means. And a Barbie nose in general means a very small nose. And when you're creating a small nose, I want to talk to the patient about what happens when we make a big nose smaller. So, when you make a big nose smaller, we have to think about the skin that covers the nose. That's the envelope. So that has to be made smaller, or that has to shrink down. We also need to think about the inner lining of the nose, which also has to shrink down. Otherwise, you will get a nose that looks small, but the overlying skin is large, so it doesn't look nice. And with the lining, you often get runny nose after this kind of operations. The third thing is when you make a large nose smaller and create a Barbie nose, you also get problems with breathing, what we call as a nasal valve issues. And then you've got to think about the long-term effects of creating a nose that is smaller. Yes, it's a trend and you create a small nose, but 10 years down the line, when the nose actually starts losing its tensile strength as such and becoming, I would say, more and more weak, in a way muscles go weak as well, you may get breathing issues. So this is something that we need to talk to the patients about. And finally, if one has allergies and things like that, and if you give these patients a very small nose, like a Barbie nose, breathing is going to be a problem. So in a nutshell, yes, you will get an aesthetically nice looking nose sometimes, but your functional problems become worse and the function actually can be a problem. So this is what I warn my patients about. So it's considering aesthetics and function and patients' desires and trying to get them the best outcome from it.
And how common is it that someone presents to you and says, I want a Barbie nose?
We see this quite often, and they generally tend to be very young. In other words, most of them are sort of 18, 19, 20, and some slightly older age groups. But they do come, and it all goes in trends, So, yeah, it is something that we see all the time. And particularly now in the days of social media, I think this is an issue, actually.
I mean, you mentioned there earlier on about the impact of social media, and obviously young people are getting a lot of information from social media, but also we're starting to see much more targeted kind of adverts, not just from surgeons, but from clinical practices as well. There are huge ethical considerations here, aren't there?
Yeah, there are massive ethical considerations. And I think one of the problems we have is we don't have, much regulation. Certainly, I work in the UK. Some countries have different regulations. And I think as practitioners, all of us, we actually owe it to our patients to have a very high level of ethical consideration. Unfortunately, it doesn't work. People post, before and after photographs. That is the photo of a patient who has in the operating room, the photograph is taken just before they have the surgery. And then a second photo is taken just after surgery. And then to show, look how great your nose has been. But actually, this doesn't translate into long-term effects and long-term result of surgery. So I think this is an ethical issue. And for me, I'm very passionate about it. I think just posting those photographs on Instagram or any other social media, I don't think is the right thing to do. At least there should be some level of control, which some countries have, some countries don't,
And so therefore, if you extrapolate that, would you therefore say that you would ban those pre and post-op photographs, or at least have some sort of disclaimer saying your nose doesn't actually look like this, you have to wait for it to stop swelling, the bruising, it can take, say, a year to see the finished result, some sort of warning for the patient that these images aren't entirely accurate?
Yes, in the ideal world, that is what I would like to see. What I'd like to see in the ideal world is really you can put a pre-operative photograph, immediate post-operative photograph if you really want to, but put in a disclaimer saying that this may not translate into this particular nose. And I think on top of that, I would go as far as saying that post a 6 months or a 1 year photograph of the same person to show what the nose looked like. Only then you will get a pretty clear idea of what it turns out to be, but I don't know if that'll ever happen.
And finally, if I may, why do you consider the European Rhinoplasty course by EUFOREA so important?
So I actually teach at a lot of courses. I get invited to a lot of courses. I think the European Rhinoplasty course, I think the most important thing is, I think it's a course that gives people, it's less of social media hype, and it's more of teaching. So I think to me, this is why this European Rhinoplasty course actually is unique, because it's not to show that, look, how good a surgeon I am. It is to actually discuss the rhinoplasty, talk to the experts, also talk to your delegates. So it's a highly, highly scientific meeting with a very good, friendly faculty. And of course, people who attend, I think they really enjoy it. So I think, to me, educationally, socially, and also based on, ethical principles, this is one of the courses that I love actually doing.
That's fantastic to hear. Professor, thank you so much for your time. That's Professor D'Souza there.
Thank you. Thanks for having me.
Wow, so many ethical considerations involved in nasal surgery. Well, many thanks to my guest, to Professor Enrico Robotti, and also Professor Alwyn D'Souza. Now, you can find more information about EUFOREA and register for the EUFOREA educational events on the euphorea.eu website, where you can also sign up to receive the latest news via email. Also, we are on social media on YouTube, X, LinkedIn, Spotify, Instagram, and Facebook. Please do follow us. But until next time, goodbye.